guys, welcome back to the Tooth Be Told podcast. My name is Brandy. I am a registered dental hygienist with a local anesthesia permit, and I have been practicing in the dental field for the last 22 years. If this is your first time joining the podcast, we are focused on providing the underserved and underprivileged communities, particularly communities of color, with the tools, resources, and information to improve their dental health care experience. And today is all about head and neck exams and oral cancer screenings. So I just wanted to pop on quickly and go over with you guys why it is so vital and important that every time you're having a checkup and cleaning, you are also having a head and neck exam as well as an oral cancer screening. So I'm going to just explain what a head and neck exam is. It's a physical examination used by a dental health care provider or a medical provider to assess the structures that are on your face, your head, your neck. Also, the sinuses, the eyes, the nose, the mouth, the throat, as well as lymph nodes and some nerves that are associated with those areas. So this should be a routine part of your medical or dental checkup, and it helps in early detection of various types of conditions, including head and neck cancers. So what is exactly done? Well, there's a visual inspection where the practitioner is going to assess the head and neck for any abnormalities. So any lumps, any bumps, any skin changes, any asymmetries. And they do so by gently feeling the neck, the head, gently feeling like the thyroid area, the thyroid gland, checking for tenderness, checking for swelling, checking for masses. Um, and then also there is a oral cancer screening, which is done inside the mouth. So there we are checking the tongue, we're checking the back of the throat, checking the palate, all the soft tissues in the mouth, the cheek, the mucosa, um, and checking the tonsillar area. So, why is it so important to have a head and neck exam as well as oral cancer screening? So, as we know, for any type of cancer, early detection is like key. So, head and neck exams are crucial for detecting cancer and also other head and neck conditions in early stages. So, sometimes we're able to detect um, any issues with the temporomandibular joint, aka the TMJ area, just for an example. Um, but there's also other wide range of conditions. So there can be infections, inflammatory conditions, thyroid problems that are also detected with a head and neck exam and oral cancer screening. So in a dental setting, when you have this head and neck exam done along with the oral cancer screening, the dentist or the hygienist will examine the lips, the thyroid, the neck, and we usually pay close attention to the area underneath the jaw, along the sides of the neck, the inside of the mouth, including the tongue, the tonsils, the back of the throat. That will also be inspected. And then we will inspect for any signs of oral cancer, such as sores, lumps, bumps, color changes, or any abnormalities unilaterally inside the mouth. So something on one side that doesn't match the other side sometimes can be a key for us to like look into a little bit more. So I'm saying all of this to say that there are many conditions that can be detected with just a quick head and neck exam. It takes me less than 30 seconds to do. I have been doing this for 22 years, and on several occasions, I have found suspicious looking lesions, lumps, bumps, or abnormalities. And one very recently, um, I had a patient in January who I was just doing my regular head and neck exam on. I found a suspicious area on the neck near the thyroid, and I suggested that the patient go see his PCP. So I let the director, the dentist, know there. He suggested the same thing, and I think I seen the patient again. It's probably been like a month now. Like he came back, and we were talking, and he started tearing up, and he's like, "Can I give you a hug?" And I'm like, "Sure, why?" He was like, "You saved my life," and I'm like, "What's going on?" And he told me that he went and had that area checked out, and it was indeed thyroid cancer, and that he was stage 3, And he was actually had, a thyroidectomy, and then he was going to be going through radiation within the next 1 to 2 weeks. And he was saying he had no idea that the lump was there, which I remember that from last time from reading my notes. And he didn't have any pain when I was touching it. He just wasn't aware of it, and he had no idea. So my point is, it literally took me 30 seconds to do that, and I'm so glad I was able to help him get that figured out, and he was able to have that diagnosed. If we can find something and detect it early, that's going to be the key to survival for a lot of people. So just wanted to put that out there. If you are not having a head and neck exam done by your dentist, by your hygienist, by both, you need to request one. It should be included in any type of checkup and cleaning appointments that you have. So it's not anything extra. It should literally just be done. But I know a lot of practitioners don't do it. So if you're not getting one, ask for one. And also just be very mindful of what's going on with you and your body as well, because a lot of people, they don't know. They don't know. And if you have the information, then hopefully you can make good use of it. So I just wanted to talk to you guys about that. If you guys have any questions, you can reach out at toothbetoldpodcast@gmail.com. Or you can check the Instagram page at toothbetoldpodcast. You guys take care. Enjoy the rest of your summer, and I'll see you soon.